Okay, great morning everyone. I would like to introduce myself first. I'm Dr. Mendiola, family medicine specialist, and one of the official speaker of FirstVitaPlus. And we are the owner of FirstVitaPlus Product Center in Lucena City in Quezon Province here in the Philippines. Sir Noel is in the United States and the satellite center is Ms. Marian Dizon. And I also work as a program manager in the Department of Health in Region 4 and one of the city technical officer in USAID or United States of America International Development. And also I serve as All-Star President of Rotary Club here in the Philippines in Mandaluyong North. And one of our sister club is Mary Ann Dizon, the Rotary Club of San Diego Valley, I think. Okay, and one of my topic for today is our immune system. You know, maintaining a healthy immune system is one of the key to staying healthy and fighting cancers and all other diseases. And if your immune system is functioning properly, your body has no other choice but to stay healthy. Okay? And let me ask first our dealers. And how well do you know your body? Okay? And how to maintain a healthy immune system. Do you remember the last time you were sick? And chances are you remember having a bad flu, colds, headache, stomach pain. And if you might have thought that you were never going to recover, but after a few days, you were feeling okay. And first to blame is usually what? The virus and the bacteria. And how does our immune system work? Our immune system, we have lymph organs of our immune system. But we also have the cells of our immune system. As you can see in our slide, these are the cells of the immune system, what you call the soldiers of our human body. The human body is the headquarters of our soldiers, and our soldiers is our cells of the immune system. And this, what you can see in your slide, is the cells of the immune system. Take note, there's a lymphocytes. As we all know, the platelet. The platelet is one of the parameters if you have dengue for a bleeding problem. There's a neutrophils, there's a basophils. These are the cells of the immune system. And I think you already know this immune system, these cells of the immune system. Why? Because these cells is found in our complete blood count. When you hospitalize, you will check your CBC, and the result of the CBC is this one. The hemoglobin, this is the parameters if you have anemia. Also the total red blood cell or the total RBC. As you can see, there is a total WBC or the white blood cell count. And this is one of the major cells of our immune system. As you can see in our previous slides, the neutrophils, the lymphocytes, the eosinophils, the monocytes, these are the cells of the immune system. And how do we interpret these results or the sample? There's a normal value or the reference value in the results of the test. If you could see the total WBC and the result is above the normal value, that means there is a signs of infections going on in your body. And how do we categorize or how do we identify which one is causing our flu or our diseases? If the neutrophils, as you can see in the neutrophils, there's a normal value. And if the neutrophils is above the normal value, there is some bacterial infections in your body. And if the lymphocytes is higher than the normal value and the neutrophils is below the normal value, there is some viral infections in your system. Okay? If there is a eosinophils, the basophils, which is the signs if there is some allergic reaction or parasitic infections going on in your system. And you know, the platelet is one of the parameters if you have bleeding problems or bleeding disorders. If the platelet is below, there is a tendency of bleeding, easy bruises, hematoma. You know, this is the cells of the immune system. This is the first test if we are going to test our immune system. This test is different in our blood chemistry. Okay, there's a fasting for about 8 to 12 hours fasting, no fluids intake, no food intake. So that is what you call the fasting. You start your fasting in the middle of the night, 12 midnight, up to morning. Okay? These are the example of fasting blood chemistry. The glucose, you know, the glucose is the sugar. Okay? If the glucose is above normal, there's signs of hyperglycemia or increase in blood sugar level. You know the creatinine? What is creatinine? This is the waste or toxin in our kidney. And if the creatinine is above normal, there's signs of damage in your kidney. The BUN or blood urea nitrogen, you know, this test is important to identify how well your kidneys and liver are working. It is the measure of amount of urea nitrogen in our blood. So this is the parameters to test our liver and also the kidney. And you know, the blood uric acid, the total cholesterol, the triglycerides, these are the fats. But take note, no? The HDL is good cholesterol and the LDL is the bad cholesterol. Okay? And how does our immune system work? In our system. You know, as we begin to explore the immune system, it is important to remember that our immune system has ability to learn and remember these kinds of pathogens or invaders. Okay? You know, example, there's an organism, over billions of organisms that will attack our immune system. But you know, our immune system is clever. Why? Because our immune system has ability to remember or learn what kind of virus or this bacteria will our immune system encounter. You know, there is what you call the line of defense in our immune system. As you can see in your slide, these are the some kinds of pathogens. You know, take note, pathogens means living things or non-living things that can cause harm or disease in our system. And one of the examples is, as you can see in your slide, is the invaders or the invading enemies like fungus, cancer, parasites, virus, and bacteria. You know, these invaders are living things. The non-living things that can cause that can cause harm to our system is the chemical toxin. Okay, there's a first line of defense, the skin. Skin, mucous membrane, the hair, cilia. You know, if the skin is broken, there's a tendency that bacteria or virus can enter our body. You know, that this is what you call the first line. Why? Because maintaining acidic environment in our stomach is one of the role of our immune system. So that's why it is normal that our stomach is in acidic environment. You know, the tears and saliva, it has antibiotic property. So that's why it is part of our immune system. The reflex, particularly the coughing reflex, why? Because lining of our lungs or respiratory system is part of our immune system. Also the skin or the mechanical barrier. But sometimes, there's a tendency that your skin is broken. There's some kind of virus or bacteria that enter our body. So, our second lines of defense sets in. So, that is the function of our second line of defense. And what are these second line of defense? These are the cells of our immune system. You know, the phagocytes, the previous slide, there's a natural killer cells, the protective proteins, the cells of the immune system. And after the second line, there is what you call the third line. And what is the third line? This is what you call the T cells. Because this is responsible for producing our antibodies for a specific type of invaders. Example, the virus. Okay, our immune system will produce the antibody to specific kind of virus. If there is injection, example, the vaccine, that is what you call the passive immunity or passive antibody produced by vaccine. If it is from our immune system, this is what you call natural antibody or natural immunity. Okay? So as we go through this, some kind of invaders or immune system, how does the immune system works? Example, if you have a punctured skin, okay, there's a pin that causes puncture in your skin. You know the pathogen, as I mentioned earlier, the pathogen is the one that is being caused by diseases or bacteria or virus. There's a pathogen, the green one. There's a pin in your skin. And what is the role of our immune system, of our cells of the immune system? The macrophage, which is the one of the cells of the immune system, is responsible for identifying if there's invaders or there's a macrophage. As you can see in your slide, the pathogen will enter in your skin and the macrophage will give signal to the phagocytic cell. And the phagocytic cell will go out to its position and it will engulf this kind of bacteria. And after engulfing, the immune system or this cell will kill this bacteria and it will degrade this bacteria. And that is what you call the phagocytosis. There is some stage of phagocytosis. There is attachment. As you can see in last figure, the bacteria is being attached to the phagocytic cell. After attachment, there's engulfing, there's killing, and there is degradation. Okay? As we go back to the first figure, the red blood cell will go out through the outer part of your skin, which will that will form the blood clot, so that no other virus or bacteria will enter in your skin. And the role of this macrophage is responsible for giving signal to a specific cell. Okay, and this specific cell, the phagocytic cell, will go throughout and it will kill this bacteria. But what will happen in your skin, the outside part? This is being happen inside our body. Okay, and what will happen in our outer portion of our skin? There is what you call inflammation. So there's a redness, there's a pain, there's a heat. Okay? Sometimes we often feel redness, heat swelling, and pain at the site of the wounds. And that is one of the cardinal signs or the signs of inflammation. This is what you call the inflammatory response. Actually, this is the body defense mechanism to destroy the invaders. So this is normal process. Okay? Example, if you have tonsillitis, that is normal. There's inflammation in your tonsils because there's invaders, and actually the immune system will attack the invaders. So there's a reaction, and that is what you call the defense mechanism. Okay? So it is important that our immune system is in balanced state. Why? Because if your immune system is unbalanced, okay, there is overactivity of our immune system or there is underactivity of our immune system. You know what? If there is underactivity or poor immune system, the patient or the person is prone to infections or even cancers if your immune system is weak. And if your immune system is overactivity, also, you are prone to diseases. Example is allergic reaction. If your immune system is overactivity, you are prone to allergic reaction, or the worst one is the autoimmune diseases. And the exact cause of autoimmune diseases is still unknown to medical community or medical society. Okay? This is being answered by unknown etiology, or sometimes it is imbalance of our immune system, which is unknown also. If you are a healthy immune system, the normal process is there's a human body, there's a immune response, and there is a bacteria. If you have overactivity or autoimmune diseases, you know your immune cell will attack your human body. And the bacteria will also attack your human body. So, your immune cell will react to your immune system. So, that is what you call the autoimmune disorder. And what are these example or the common example of these autoimmune diseases? You know, we have a human body system. And if you have autoimmune diseases, your human body system is affected. In the brain, the common one is the autism. You know, autism, hyperactivity, autistic. So that is one of the autoimmune diseases of the brain. Another one is in the bones, the rheumatoid arthritis, which is different from osteoarthritis. The muscle dystrophy, the skin. In the skin, we have psoriasis. Also is eczema. In the nerves, the neuropathy or diabetic neuropathy or polyneuropathy. In the GI tract, in the left portion in your skin, the GI tract or the gastrointestinal tract or digestive system. The common one is the diabetes. Diabetes type 1. In the blood, there is leukemia or lupus. Okay? That is in the blood, the leukemia and lupus. And these are the common diseases of our autoimmune or the immune system caused by imbalance or overactivity of our immune system. And let me tackle this topic. One of my topic for today is this kind of diabetes. You know, diabetes is a serious complex condition which can lead to increase in blood sugar level. That is diabetes. And when your body fails to produce this some adequate level of insulin, and your blood sugar will stay in your blood. You know, as we look at the slide, the healthy human body, and the yellow one is the organ producing the insulin. Insulin is a hormone. Okay? This is the pancreas. If you are healthy, the pancreas will produce this insulin. The glucose is the blue one, or the sugar. Okay? The insulin will pass through this glucose, and this glucose will be converted to energy. So, the one responsible for this glucose converted to energy is this insulin. If you are diabetic, as we all know, this is one of the immune disorder or autoimmune diseases. the immune cells of the immune system, will destroy these beta cells in the pancreas. And these beta cells or these cells is responsible for producing insulin. And if it is destroyed, there is no production of insulin. So that's why more glucose is in the blood that is not being converted to energy that is being used by our cell. So this blood will stay, glucose or sugar will stay in the blood. So that's why if you're going to hospital and if you will check your blood sugar level, it is increased because the sugar is not converted to energy. Okay? So this is one of the best diagram. What is diabetes? You know, glucose is converted to energy. In order for glucose to be converted to energy, you will need insulin. Okay? If there is no insulin production, that is diabetes type 1. If there is not enough insulin production, that is diabetes type 2. If you are pregnant, that is gestational diabetes. Okay? What will happen if your blood sugar level is uncontrolled? Okay, there's a complication of diabetes. There's what you call this complication. And what are the common complications of this diabetes? Blindness or the diabetic retinopathy. Okay, another one is coronary artery diseases. If you attend my webinar last Wednesday, one of my topic is this kind of type of heart diseases, which is the common type, the coronary artery diseases. Another one is stroke or cerebrovascular diseases, one of the complications of this diabetes. And of course, the dialysis or diabetic nephropathy, which is diabetes-induced kidney disease. The common one is that tooth decay, polyneuropathy, darkening of nerve due to autonomic nerve damage. So there is not enough blood supply in lower portion in your legs. So that is discoloration in your legs. The question is diabetes controllable or preventable? You know, there is risk factor in your family that cannot be that is already known. But you can control yourself for diabetes through healthy lifestyle or proper nutrition. And, you know, blood sugar stability plays a major role in this kind of inflammation in your immune system. And one of the most powerful anti-inflammation compound within the body is, you know, the hormone, which is the cortisol, and that is the stress hormone. So it is important, you know, if you are stressed, it will trigger your sugar level. So that is one of the contributory factor. It is important that your cells of the immune system is healthy. Also, there is what you call the organs of the immune system that is being responsible for producing these cells of the immune system. For example, this thymus is responsible for producing these T cells, which is responsible for producing our antibody. That is natural antibody or natural immunity. And these B cells or the bone marrow is responsible for producing the B cells. So these are the organs of the immune system. And how to maintain this healthy immune system and how to boost this or how to balance this immune system. Of course, through this balanced diet and additional vitamins. And what are these vitamins? Essential vitamins needed by our body to maintain the balance of our immune system. This kind of vitamins, the vitamin A, the vitamin C, the vitamin D, also the mineral, the zinc. These are vitamins for strengthening the immune system. Okay, let's talk about this kind of vitamins. First, the vitamin A. You know, vitamin A, as we all know, this is responsible for reproduction. So it is also good in our sight or in the eyes. But you know what? This vitamin A is good in our immune system. How? This is responsible for increasing in our lymphocytic response. As you can see in our previous slide, the lymphocytes, as you remember, do you remember the lymphocytes? What is the lymphocytes? That is one of the major cells of the immune system. So vitamin A is responsible for increasing the lymphocytic response. Another one is the total WBC in your complete blood count. Vitamin A is the one responsible for improving white blood cell. So these are the one of the amazing benefits of this vitamin A. And another benefits of our immune system for our vitamin A is also in our heart problem, in our urinary stone. So boosting immune system, of course. In our skin, vitamin A is good as an antioxidant. Okay? Another one is this vitamin C. As we all know, vitamin C is good in our immune system. If you are thinking what is good in immune system, first come to think of mind is this vitamin C. But how does this vitamin C work in our immune system? There's some kind of benefits of vitamin C, the skin health, heart problem, cancer, in our eyes, reduce immune system deficiencies. But in immune system, how does this vitamin C work? You know, there's another interesting fact in this immune system. You know, this is our human body. And the human body is our headquarters. Headquarters of what? Of our soldiers. And our soldiers is our cells of the immune system. This is the immune response. This is the invaders. Okay? Our soldiers and this vitamin C, you know, vitamin C will act as our ammunition. Okay? This vitamin C is our ammunition of our immune system. So that's why if immune system, vitamin C is needed because this is our ammunition to fight this against infections or this bacteria, virus, or bacteria. So that is the role of this vitamin C. Okay? Another vitamins is this vitamin D. What is this vitamin D or the sunshine vitamins? At least 15 to 30 minutes exercise in the morning, 6 o'clock to 9 o'clock in the morning. What is the role of this vitamin D in our immune system? And one of the main functions of this vitamin D is to help activate the T cell, also known as the killer cell. Okay, the dendritic cell, the monocytes, the macrophage, which is the cells of our immune system. So vitamin D is responsible for maintaining the functions of our immune system. So that's why vitamin D is good or needed to boost our immune system. Another one is this zinc. How does this zinc works or improve or strengthen our immune system? This is good to this interferon alpha by inhibiting the replication of virus. Okay? And one of the primary mechanism that zinc work is this inhibition or stopping the replication of virus inside our body or inside our cell. So that's why it is being called as our sidekick of the immune system. Also, zinc also plays a major role as an enzyme functions in our immune system, as an antioxidant. So that is the role of zinc in our immune system. As we all know, there are a lot of diseases that can decreases the lifespan of our community of the Filipino. And you know what, in 2012 up to 2020 last year, the lifespan or the average lifespan of the Filipino is only 68 years old, both male and female. And of course, the leading cause of death is still the cardiovascular diseases or the heart problem. And the second most common is malignant neoplasm or cancer. And the third one is pneumonia. Pneumonia, or what organ is affected? The lungs. You know, we are in the state of pandemic due to this kind of virus, the coronavirus. And what is this coronavirus? This is a group of virus that causes diseases in human body. Okay? And one of the organ affected is the respiratory system. And how this coronavirus transmit? Of course, through respiratory droplets. And if there's a droplets, and the point of entry is through the skin, through the nose, through the eyes, through the mouth. So how does this pathogen enters our body? Through ingestion or punctured wounds. And also the mucous membrane, particularly the mouth, the nose. So that's why health protocol is needed. Wearing face mask or face shields. Okay? So, if the immune system is weak, you know, there are some factors that weaken our immune system. And what are the things that can cause harm to our immune system? You know, smoking, one of the major factors in any kind of diseases. Smoking. Another one is alcoholic beverage drinker. You know, alcoholic beverage drinking is one of the global problem, and it's related to respiratory disease syndrome. Another one is not getting enough sleep, at least 6 to 8 hours. Sedentary lifestyle, no vitamins. And one of the important factors that can harm our immune system is this one, the negative emotion, or what you call the stress. As we mentioned earlier, the stress is related to increase in blood sugar level. Okay? If you are stressed, you know, you are negative. You have poor judgment in your mind. And followed by your body, you will feel headache, you will some muscle twitches, some skin irritation that can trigger your skin problem. The eczema, the psoriasis, even lupus, it will trigger. Followed by emotion. You will lose your confidence, irritable, anxiety, and depression. Then your behavior. You will drink too much alcohol, smoking. So it will trigger your diseases. You know, if you are stressed, as I mentioned earlier, there is what you call the stress hormone, the cortisol. And this stress hormone is being released in our adrenals. And it will perceive as something, as a threat in our immune system. So your immune system is in war zone. So there's what you call the threat. It will trigger your adrenals to release more adrenaline or more cortisol or this kind of stress hormone. And that is the natural response of our immune system. It will, you know, the war zone, there's alert. So if you are alert and if your stress hormone is high, you know, your immune cell will attack the normal cell. And the invader will also attack your normal cell or human body. So the autoimmune diseases sets in. So there's a lot of diseases related to this stress. Okay? So now you know stress and blood sugar level, it is related. If you are stressed, this adrenal will release this kind of stress hormone and epinephrine or the cortisol, and it will trigger your blood sugar level because it will trigger your autoimmune diseases. Okay? You know, 98% there's evidence-based, no? 98% of diseases is related to stress. That degenerative diseases, this is related to stress. And it is the number one killer, stress. And what are these diseases related to stress? As you can see in your slide, number one, the heart diseases. The second one is the cancer. Oh, there is no history of family cancer. No history of genetics or cancer. How come I have cancer? You know what? Only 5 to 10% is related to family history when you talk about cancer. And the majority of causes of this cancer is the 90 to 95% is through environmental factors. And one of the factors or contributory factors is the smoking. So, cancer is related, of course, to smoking. The stroke, the diabetes, the asthma, all kinds of diseases. This is related to stress. Let's talk about the number one, the heart problem. You know, there are many types of heart diseases. The valvular diseases, there's incomplete closure of the valve in your heart. The cardiac arrhythmia, there is disorganized signals or the electrical signals in your heart, in your beat. So, example, when you are walking, suddenly drops. So, the finding is cardiac arrhythmias or sudden death. The heart failure, there is what you call the dilated compartment or dilated ventricles in the lower, in the portion of your heart. The aneurysm, there is balloon in the vessel. That is aneurysm. Ballooning or thoracic aortic aneurysm, that is what you call balloon in the blood vessel. The cardiomyopathy is thickening of the muscles inside your heart or the myocardium. Okay? And inflammation in your heart, it is what you call the pericarditis. There's inflammation. There's a swelling, or in your skin, there's a swelling, there's redness. In your heart, there is inflammation, the pericarditis. And one of the common type of these heart diseases is the coronary artery diseases or coronary heart diseases. And what is this coronary heart diseases? You know, this is the healthy artery, the clean one. If there is blockade inside the blood vessel in your heart, that is heart diseases. And coronary diseases is being called coronary artery. Why? Because this is the major supply in your heart, the right and the left coronary artery. If there is a blockade in the blood vessel in your heart, so there is no enough blood flow. So there is a discoloration in the lower portion of this heart because of the block in this portion in your blood vessel. And what causes this blockade? What are the causes of this blockade? How come you have a heart problem or heart diseases? That is due to, take note, atherosclerosis. What is atherosclerosis? This is hardening of the blood vessel due to deposition of fatty, take note, fatty substance, cholesterol, and abnormal cell inside the walls of the blood vessel. Then, and how does atherosclerosis develop that can damage to our cell? Okay, through high blood pressure, high cholesterol, smoking, nicotine, diabetes. So, atherosclerosis start with damage or injury to the inner layer of the artery due to or caused by these diseases, high blood, cholesterol. Oh, you are normal, no? My blood pressure is normal. My blood sugar is normal. How come I always feel dizzy? Or you check your blood chemistry. After checking the blood chemistry, or your total cholesterol level, particularly the bad cholesterol, is too high. Bad cholesterol can trigger atherosclerosis, high cholesterol. Okay, also the diabetes. Nice to know. You know, hypertension and diabetes is the one of the common cause of dialysis or renal failure or kidney failure. Okay? What the medical intervention or treatment if you're having this kind of diseases? You know, the angiogram, the angioplasty, of course, surgery or bypass. And this bypass is too much expensive. Why? One vessel costs at least 300,000 in the Philippines. If you are triple bypass, almost 1 million. The question is this heart diseases preventable or controllable? You know, you can change some factors like family history. If you are having family history of heart problem, diabetes, you cannot change that. But in yourself, diba, you can limit your food, which is high in salt, cholesterol, and fats. Diba? Okay? Also, eating plenty of fruits and vegetables. And, of course, proper exercise. At least 30 minutes per day, 15 to 30 minutes per day. According to WHO, plenty of fruits and vegetables. That's why our product is very good in maintaining healthy body or healthy immune system. Because we have 5 vegetable which is good in all sorts of this kind of vitamins. The malunggay, the daw ng sili, saluyot, ukay, talbos na kamote. Form in a powder form or fish tab, the titanium part. And what are the benefits of this vegetable? You know, malunggay is good in normalizing our blood sugar, good in malnutrition, antibiotic property or antibacterial property, antifungal, anti-inflammation. As we discussed earlier, the inflammatory response, anti-cancer, good in skin condition. And when we talk about the vitamins, you know, malunggay is very good or high in this kind of vitamins, vitamin A, vitamin C, the zinc. That's why malunggay is being called the miracle tree or miracle vegetable. Another one is the dahon ng sili, which is good in blood detox. Okay, blood detoxification, improving the circulation in the blood. So that's why it is good in preventing any kind of heart diseases or cerebrovascular diseases in common, that is stroke. So dahon ng sili is good in our blood. And the third one is the saluyot, which is high in antioxidant property, particularly the vitamin E. Also, it is good in our digestive problem, such as diarrhea, constipation, even ulcers. Take note, diarrhea or constipation, even ulcers. So, saluyot is good. The fourth one is the colitis uri, which is the mucolytic and good expectorant. That's why it is good in any lung problem or respiratory problem. If you are suffering from COPD, bronchitis, emphysema, pulmonary tuberculosis, pneumonia. So, this vegetable is good in expectorant or expectorant or mucolytic property. Also, one of the major function of this colitis is hemostatic activity. And what is hemostatic activity? It will control the blood problem or bleeding disorder. That is one of the role of this hemostatic activity. Also, it has anti-fertility property. Okay, and the fourth one is the talbos ng kamote. And talbos ng kamote is a good source in improving the red blood cell, or that is good in anemic patient. And also, it has the only plant with iodine, which is good in any hyper or thyroid problem, hyperthyroid or hypothyroid, goiter patient. So, it is good in a goiter patient, the talbos ng kamote. Also, it helps increases the platelet. You know, platelet, as we discussed earlier, platelet is one of the cells of the immune system. So, which is the parameters if you are suffering from dengue. So, if you are suffering from dengue, you boost your immune system to balance the immune system. The platelet is responsible for that. You know that this is the 5-page table of FirstVitaPlus with different variants. Okay, we have the landan, the melon, the guayabano, the mangosteen, and the pineapple. If you are talking for the variants, the dalandan is good in any kind of respiratory problems. And the melon is good in any reproductive problems. If you have myoma, ovarian mass, ovarian cysts, if you want to get pregnant, you know, melon is the best. Why? Because melon is one of the fruits that is rich in vitamin A, which is responsible for reproduction. You know, the guayabano, since 1976, there is some kind of studies that is related to cancer. Guayabano is being compared to one of the chemotherapeutic agent that is being used for chemotherapy. And guayabano is 10,000 times more potent than that chemical, that synthetic drug, the chemotherapeutic agent. So, when you talk about guayabano, that is good in any mass or tumor. So, we have lots of testimony in this guayabano that is good in any kinds of cancer. If you have reproductive cancer, the example, the ovarian mass, you mix the melon and the guayabano. That is good. Another one is the fruit and veggies with mangosteen. You know, mangosteen is a good source of xanthons, which is good in any central problem. Example, if you are suffering from stroke, if you have schizophrenia, if you have bipolar, mangosteen is good. Okay, we have 5 vegetable, plus fruits and veggies with mangosteen. So that's why it is good in any central problem or in the brain problem. Another one is the pineapple. And pineapple is good in digestion. Okay. All pineapple is good in patients suffering from anxiety, depression, or any mental state problem. Because pineapple has a property of a happy hormone. So that's why it is good to balance your immune state or the mental state. Okay, we also have the gold line and we also have the platinum line. You know, platinum line, no added sugar, no added coloring. Platinum line is ideal or recommended if the patient is, you know, the complicated patient. You have many maintenance, you have many diseases. Sample, if you have cancer, if you have skin problem, if you have psoriasis, if you have virus. So, the ideal product for you is this platinum line. Okay? So, example, you know, Carol is Carol uses this platinum. Why? Because as we all know, Carol is diagnosed with cancer. Oh, hi, Carol. Carol De Jesus. She's diagnosed with cancer. She has relapse. She has diabetes. She has skin problem, the psoriasis. What Carol is wearing, the sleeveless, the shorts. She even wear shorts or sleeveless. Why? Because her skin is flawless. Okay. So, platinum is a good variant if you have complicated cases or complex cases. Okay. Also, if you have cancer, just like Carol. Okay? But Carol now is cancer-free. Okay? Thanks God, thanks FirstVitaPlus, Carol is cancer-free, COVID-free. Okay? Let's talk about cancer. And what is cancer? You know, cancer is abnormal cells that can divide uncontrollable. You cannot control the cancer. That your normal body will be destroyed by this cancer. You know, cancer is an extra cell, not the normal cell, but an extra cell that can divide without stopping. So, this is rapidly producing cell, the cancer cell. The orange one with pink inside is the normal cell. The green one is rapidly producing. That is the cancer cell. So that's why if you have breast mass, and as you notice, the breast mass, you diagnose with breast mass December. In January and February, the mass is big. Oh, that is high probability that is cancer because cancer is rapidly producing. Okay? But there is some kind of cancer that is not tumor. The leukemia, cancer in the blood. And how does this cancer in the blood form? Due to imbalance of the immune system. As we discussed earlier, autoimmune diseases, imbalance immune system. In the blood, there is leukemia, cancer in the blood. Okay? So this is the mass or the tumor. It can develop everywhere. As I mentioned earlier, only 5 to 10% are due to inherited or due to genetics. But mostly 90 to 95% of cancer is due to environmental factors. And one of the common environmental factors is smoking. Another one is, of course, the stress. Stress is related to cancer. That's why stress is the number one killer. Okay? Let's talk about the common cancer. And one of the common cancer is, of course, the lungs, the breast, and the colon cancer. As we go through the medical intervention, what is the medical intervention if you are diagnosed with cancer? Of course, the surgery. If you have mass, you have tumor, you go to operation. Another one is the chemotherapy. And what is chemotherapy? It will kill the cancer cell. Also, the healthy cell, the fast-growing cell. Okay? Another one is the radiation therapy. But there is some that don't want to undergo surgery or chemotherapy. What will the patient do? The immunotherapy. And what are these immunotherapy? You will use your immune system to treat cancer. You will strengthen or stimulating the immune system to work hard to attack the cancer cell. And that is what you call the cancer immunotherapy. And platinum line is one of the best product. Also the titanium edition, the Forte line. Okay, the revitalized Forte. Okay? So another one is this watermelon. The titanium watermelon, which is good in blood circulation. So that's why watermelon is called the natural aphrodisiac because it is good in our blood supply. Okay, we have the new product, the 34-in-1, and of course the Forte. Okay, so that is the wonders of FirstVitaPlus. Let's talk about the testimony. One of the testimony, this is my cousin. My cousin suffered from prostate enlargement. After taking Guayabano Gold for 8 months, the size of the prostate is normal. So this is one of the patient of Maggie and Pipijak, nodular non-toxic goiter. So take note, if you have goiter, you drink FirstVitaPlus, sometimes you will experience detoxification. What would you feel? A kind of pain in your neck, or some sort of there's obstruction in your neck, but you continue drinking FirstVitaPlus. Afterwards, you will vomit or you will feel something. Then you will notice that your goiter is reducing in size. So just continue drinking FirstVitaPlus. So this is a patient of Pipijak, also my patient in one of my medical mission in Pasig. The patient suffer from diabetes and he has a gangrenous foot, right foot. And one of my colleague, the surgeon, scheduled him for operation. But the patient refuses. So the patient continued to drink. Take note, sweetened one. Twice a day, 10 boxes of FirstVitaPlus. The sugar from 500 to normal. And the gangrenous foot from gangrenous to normal again. So, twice a day, continuous drinking FirstVitaPlus. So this is the patient from San Diego. So Sir Romeo. So COVID patient at that time, lockdown last April, the patient in US, the product is guayabano gold and pineapple. And the patient has no medicine, home quarantine, senior citizens, and good, praise God, the patient was able to donate blood in American Red Cross. Okay, we have a lot of testimonies suffer from COVID and survive due to with the help of FirstVitaPlus. Of course, prayers and FirstVitaPlus. And one of the brothers of Sir Noel and Ma'am Nancy recovered from these diseases. Also, one of the brother of Miss Mary and Dizon also survived in these diseases, the COVID, the coronavirus. With the help, of course, of God, prayers, and our product, the FirstVitaPlus. Okay? So this is Romeo. We have lots of testimonies, which is very good. We have license, LTO halal. Okay, we have these kinds of certificates, US FDA. What is the ideal intake of FirstVitaPlus? Of course, if you are normal and if you want to prevent any kind of diseases, you will take 5 to 6 serving of vegetable. And one sachet of FirstVitaPlus is equivalent to 5 serving of fruits and vegetable. If you have maintenance, if you're sick, the ideal vegetable intake is 9 serving. So, you will take FirstVitaPlus at least twice a day. If you are sick, if you have maintenance, the ideal intake of FirstVitaPlus is minimum twice a day. If you are normal, you have no maintenance, you are well, it's okay if you want to take FirstVitaPlus once a day. But we have no overdose. If you want to take FirstVitaPlus 2 to 3 times per day, that's okay. 4 to 5 times per day, that's okay. If you want to take FirstVitaPlus 1 box per day, much better. Okay? If you have maintenance, just combine it with your FirstVitaPlus for at least 2 to 3 months. And after 2 to 3 months, you go back to your attending physician, you check your blood chemistry, and if the blood chemistry is normal, we will reduce your maintenance medication. And that is what you call the integrative medicine. Okay? Your health defense in your lifestyle.